Hi, I'm James, and today I'll be talking about preparing stroke medical imaging data for AI-driven diagnosis. We'll dive into intro on the problem that I'm solving using AI medical imaging, the problem itself, motivation behind the problem, where I'll show you a map indicating how big it is, and then dive into the theoretical background, where we'll look at the perspective of the neuroscientist slash radiologist, how a human would do the stroke diagnosis, to the point where we do data preparation for AI-driven stroke diagnosis. And then we'll have sort of a conclusion or discussion on questions for the experts. The problem that I'm looking to solve is finding stroke lesions in CT scans, MRI scans, quicker, more efficiently, with more reproducibility to assist the radiologists in diagnosing stroke. And on the right side, we have an example of a CT scan with a healthy brain, normal brain on that left. And then on the right side, we have a hemorrhagic stroke brain. And the nice thing about CT is it shows a nice region for what looks like to be blood leakage, right? And then from Khan Academy, they did a nice job of actually adding some annotation to it where they drew around that region for the blood. In this case, we can see this is a normal brain, and we have the left hemisphere, the right hemisphere, they're equal or symmetrical, and then we have these nice edges that are drawn or delineated very nicely, and we have this outer surface, which is known as the gray matter, with contrast to this inner parts of the brain known as the white matter. And on a healthy brain, those are different. And then here's a special MRI type of scan. On the left, we have a normal brain, and we have this region that's circled blue with some red, yellow on the outside parts, and then black and sort of like blue tracing around it for normal blood flow. And then in this case, though, there's this whole red region that is signifying lack of blood flow. And this yellow region is healthy blood flow. So one of the benefits of MRI is it's sensitive to ischemic stroke or ischemia in the brain and can show the brain blood flow where the hemispheres lack blood, as in this case. So why are we looking at doing AI-driven medical imaging for detecting, segmenting stroke lesions? Well, the two types of stroke that we're looking to combat are hemorrhagic stroke on this right side. It's a frame from Nucleus Medical Media. They put together a nice simulation where we have this blood vessel or a blood vessel in the brain that maybe because of an aneurysm from it's like a outer sphere balloon shape that's weak spot on the blood vessel bursts open, and then we have all these blood cells that are leaking out into the brain. And so we can see here in this nice depiction, there's a lack of blood flow to this other area of the brain, other regions of the brain, causing a hemorrhagic stroke. On the left here, we have a nice visual of this blood clot that forms in the brain blood vessel, causing lack of blood flow to this other region of the brain, killing off brain cells, neurons, etc. And here's a quick simulation. So we go into the brain and nucleus media, right? These are the neurons. This is one of the blood vessels. And then going back. So this is the region of that blood vessel, a blood vessel that bursts open, and we can see the blood cells are bleeding out into the brain. And then this particular depiction is that aneurysm I was talking about. that balloon-shaped sphere on the outer part of the blood vessel. Blood leaks out, fills the skull, the area between the skull and the brain, causing the brain to swell up. And so one of the treatments is sort of like minimal invasive surgery procedure. You clamp that area of the blood leakage, suture it up, and then we get healthy blood flow again. That was nucleus media, another nucleus media. So this is for ischemic stroke, their animation and going in. So we got normal blood flow in the brain, blood vessel, oxygen, glucose, and the neurons and electric pulses. And then all of a sudden a blood clot forms, creating a lack of blood flow to a certain region of the brain. Each case ends up killing off brain cells, neurons. And so this is known as thrombus, thrombosis, or thrombotic stroke, where the blood clot forms directly in the blood vessel of the brain. This particular depiction here that they're showing is embolism, where there's some external blood clot that travels up to the brain's blood vessel and gets stuck, forming a blood clot in the brain blood vessel. So doctors, specialists will prescribe medication to dissolve that blood clot. In some cases, they'll even do a type of surgery to remove the blood clot, etc. That is the problem we're looking to solve. The earlier we can get to the stroke lesions, the better. And that's our goal with AI-driven medical imaging. There's a lot of motivation behind incorporating AI. As we can see on this right side, this is a picture of the world map from Khan Academy. The dark red regions simplify a high incidence of stroke, whereas more the blue, green, less stroke. We can see there's a ton in this region here in Russia, Asia, and East Europe. Also to note, it's very common, stroke's common in low income countries. And then there's also middle, incidents in the US and Canada and so forth. There's 17 million people experiencing stroke. 7 million die and 5 million are permanently disabled. So those are the estimates. To note, stroke is the second leading cause of death, making up 10% of all cases after heart disease worldwide. Another finding is strokes occurring more often in young and middle-aged people under 75 years old. And I think I have an idea why that's happening. We inherit bad genes, genetics, from our parents typically. For instance, I have hypercholesterolemia, which is an increase in the bad cholesterol, LDL, and then my body is not able to break it down fast enough. So one of the approaches to treat that is, taking medication by the doctor. But it's important to find it early enough. I'll talk about cholesterol's connection to stroke soon as we dive into the neuroscientist theoretical background portion. And then also there's a lot of difficulty stroke can cause: lack of breathing, swallowing, speaking, seeing, heart function. So it's even more important that we look to assisting the radiologists in their endeavors with combating stroke. So let's dive into the background of the neuroscientist / neuroradiologist on their perspective to stroke. So here on the right, we have a hemorrhagic stroke drawing. Again, credits by Khan Academy. So hemorrhagic stroke makes up about 20-25% of cases, and it's more fatal, deadly compared to ischemic stroke. So in this region, we have, again, like that simulation earlier, somewhere in the brain's blood vessels, a blood vessel will burst open and blood will leak into the brain, and then lack of blood flow to these other blood vessels and other regions of the brain, causing brain cells to die and neurons to die. But also another issue is lack of circulation to the different area, cerebral circulation to the different areas of the brain. And then by the blood leaking out and coming in contact with the other brain blood vessels here, what actually happens is they go from a nice wide blood vessel to more of this narrow blood vessel, and that typically is called a vasospasm. So vasospasms are, and so one thing we can see here with this wide artery is a lot of blood flow in the brain. But as it narrows down because of the vasospasm, there's a lack. The blood flow slows down. And so, again, more regions of the brain, like these lower parts, get a lack of blood flow. And so what the tragedy of that is the patient could actually get a secondary stroke. So that's something we have to watch out for when it comes to hemorrhagic stroke, some of those bad things. And of course, by lack of blood flow, the brain cells and neurons miss out on oxygen and nutrients that are needed. And again, the blood leaking into the skull cavity, these are the different ways that the patient suffers. Now we dive into ischemic stroke, and we're going to look at some of the major causes of that. So one of the major causes is, of course, embolism, and the other is thrombotic. And then in the next, we'll look at watershed stroke from ischemic. So the main idea with ischemic stroke is a blood clot forms in an area in a blood vessel in the brain, and the patient suffers. With an embolism, it's some area within another part of the body. Let's say the heart, right? And these arteries could be clogged in the heart due to cholesterol. And so these cholesterol plaques form, and then they break off from the blood vessel in the heart, and then they travel up to the brain, and they get stuck in one of these arteries, basilar, the middle cerebral artery, the internal artery. And so once they get stuck, what can happen too is that this cholesterol plaque actually bursts open, causing a blood clot, causing lack of blood flow to the brain. In the case of thrombotic stroke, though, these cholesterol plaques form directly in the brain, in these larger blood vessels. And so they cause lack of blood flow. And hence brain cells die and ischemic stroke takes off. In the case, and this is typically known as atherosclerosis, the other kind of stroke from thrombotic is a lacunar stroke. So instead of these large blood vessels, it's these smaller blood vessels where there's this highlighted white region. So these small blood vessels, lacunar patients typically suffer also because of hypertension. And with hypertension, there's an increase of blood pressure, stress, and strain. A ton of blood at a quick rate is just flowing through these thin blood vessels. Too much pressure, too much strain on these blood vessel walls will cause the thinness. Instead, they'll actually thicken up, slowing down the blood flow. Another issue, and so what they typically will do, they'll administer blood thinners to thin up these walls again. Another issue, though, that can come up too is for the lacunar stroke patients, they could actually suffer from atherosclerosis as well, where these cholesterol clots build up and lack of blood flow. There's one more type of ischemic stroke, and it's known as watershed. I don't have it viewed here at the moment, but what that is so typically we have blood that flows into the brain and out of the brain, and then out of the brain and back into the brain. And what happens with watershed stroke is there could be some cholesterol clot that forms in this lower artery here before the brain, and this lower carotid artery here, causing a lack of blood flow in and out of the brain. And when that happens, we actually have less blood flow, right? And so these middle regions, say in the hemispheres, left and right hemisphere, actually get a lack of blood flow. So this watershed region is typically this middle region in the brain. So now we dive into the stroke diagnosis while keeping in mind that this is some of the background that the neuroscientists and neuroradiologists have when dealing with stroke cases. And now they're more focusing on examining the different types of imaging, as well as giving patients an interview on their history, their stroke symptoms, and seeing, what is the case, how severe the stroke is. Okay, so yeah, typically a doctor will interview the patient. They'll learn about the stroke symptoms that the patient may be experiencing and giving them a physical exam to see if there's any indication of brain damage from the stroke. And medical imaging is a crucial part of stroke diagnosis, and a human typically will go through and identify certain regions of the brain that are suffering from stroke. This is the piece that we're looking to automate and assist neuroradiologists with the AI-driven approach using deep learning. The two types of most common imaging is computed tomography and magnetic resonance imaging and angiography. Angiography is a type of special CT scan that shows the blood vessels in the brain. Again, so here's just a quick view of the normal brain. We have two equal hemispheres, left and right, that are symmetrical. We can see here these edges, the outer part of the brain. We can easily trace them, or the delineated curves of the brain. And then we have these edges that are contrasting the inner parts of the brain. The outer part of the brain's outer surface is known as the gray matter, and the inner part is the white matter. Now let's look at the CT scan for stroke diagnosis. So this is an example of a normal brain versus an ischemic stroke brain just after a few hours of a patient going through ischemic stroke. A CT is a special X-ray that allows us to look at the brain from lots of different angles and views. In fact, we can also take a set of CT scans and we could do some computed calculations on it to go from a 2D to a 3D reconstruction, creating a 3D brain model, or 3D brain model with stroke lesions segmented or detected. Some of the features to keep in mind that a neuroradiologist may keep in mind of a normal brain when looking for some of the issues that a patient may be suffering from in a ischemic brain. So the CT features in a normal brain, again, it's this curvature that we talked about where you could easily trace it, or the delineated curves. The outer surface and the inner parts of the brain are contrasting, so that gray and white matter. the symmetry. But one of the downsides of the CT and stroke brains is the changes typically show up at least 12 to 18 hours after the patient has gone through a stroke. So it takes time for the brain changes to appear in CT scan. Here's another CT scan, but this one was taken 48 hours after the stroke. And so on this right side, we see, again, normal brain and stroke suffered brain. We can see this purple region that's highlighted is actually swelling of the brain, right? And this affects the middle cerebral and artery territory. And so with the swelling of the brain on this left hemisphere, left hemisphere, right? My left hemisphere. When a doctor or specialist is going through the stroke diagnosis, the physical exam, they may notice that the patient has a hardship of moving the right arm, their right leg, and it'll make them think, okay, maybe there's an issue on their left side of the hemisphere from the stroke. And clearly we can see that in this CT scan. On this left frame, again, normal brain and stroke brain, so the swelling is causing a loss of gray matter, white matter contrast. We can no longer tell the difference between, the edges that were there, as we can see, and the internal part of the brain. They're no longer contrasting as easily like before. In addition, the delineated curves, or these curves that we could easily trace, are no longer so sharp, so it's harder to see where to trace them. And then the swelling is actually causing a lack of symmetry between the left and the right hemisphere, left and right hemisphere. And this left hemisphere is actually bulging out to the right hemisphere. In addition, the swelling is also causing some compression on these ventricles, especially this ventricle in the left hemisphere. And what happens with that is we have this cerebral spinal fluid that provides bathing and nutrients for the brain that swells up, or that compresses up and causes a lack of performance there. The other common in medical imaging is MRI scan. An MRI scan uses magnetic fields and radio waves to enable us to see high definition brain tissues and surrounding structures. Comparing to CT scan, MRI scan is more sensitive in detecting ischemia in the brain and the ischemia, the brain changes can show up in as quick as 30 minutes. Whereas with the CT scan, the brain changes can take up to 1 day to appear. One of the hardships with the MRI approach is they're typically less available. So doctors will typically have the patient go through a CT scan. And then as we can see in the MRI scan in this right frame, here's a normal brain and here's ischemic stroke suffered brain. Within 30 minutes, the brain changes show up. So we have this swelling again in the middle cerebral artery territory, and then this light area is actually the normal. So we dove into the neuroradiologist perspective on background information with stroke, the major causes of both types of stroke. We also went into breakdown of how they diagnose stroke for patients. And next, we're going to look at the data preparation that's required to train deep learning models for stroke diagnosis and AI-driven stroke diagnosis. So Stanford Radiology's done a pretty good job of putting together a pathway for radiologists from the radiologist perspective in the hospital setting for the radiologists who want to do data preparation and potentially develop their own medical imaging deep learning algorithms. And so this pathway that they have been working on is to help overcome some of these data problems that when the AI developers get access to the medical imaging data, it'll hopefully help make that a smoother transition as the radiologists and the other healthcare providers who have access to this data in the hospitals can get a head start. So we have this diagram, it's anonymized, high quality, structured, and labeled data are all essential to solving this data problem of medical imaging. Anonymizing the data is for protecting the patient's identity, and so that universities, commercial entities, other entities outside the hospital can access the data and do research and create products around the data. High quality data for training the AI algorithms to have great performance in general as well is very important. And one of the examples with that could be, as we can see in this other slide, querying the data. So this is an even more in-depth view on overcoming this data problem. This particular diagram here shows the data preparation view. Again, it's just another way that they're depicting solving the problem. So I'm going to switch between these two slides here. But to get high quality data, one of the approaches that the radiologist can take is to query the data. So they filter out only the data they need. The other one is quality control on the data. So let's say that the problem they're dealing with is colon cancer and they're doing colonoscopy lesion detection. They filter for the colon area, and those would be high definition RGB camera images. But for some reason, MRI images show up, or CT scan, completely different type of imaging. With the quality control, the radiologists, other healthcare providers, they could filter out those images. Actually, what would probably be better for this case is they're working with lung cancer X-ray images, and for some reason, skull images show up, X-ray images, and maybe X-ray images of the feet. And so since we're just dealing with the lungs, we're going to remove those outliers. That's very important too. Another area that's important is structuring the data so that other ML engineers can pick up the data set with ease and progress. So structuring the data, an example of that could be, we have these data sets that are having a DICOM header format, and the protocols are the same. We know the protocols are the same, but the protocol names appear differently. So we just organize that piece. Another way to structure the data too could be the folder structure, and creating a nice folder structure, maybe with some assisted Python scripts that go with working with this particular folder structure data or database structure data, so that when one of the set of AI developers outside the hospital gets access to it, they have some data prep scripts to work with. Probably one of the most crucial areas in data preparation is the labeling of the data. So the AI developers were typically not the experts when it comes to identifying, detecting, segmenting lesions in stroke MRI and CT scans. We can learn how to do it. Like, we just went through the process. But what would be time saving is with labeling, we had the radiologists, a few radiologists go through, say, even a subset of the large data set, and then they did the labeling, and then we had some annotated classifier labels, bounding boxes, or binary masks to go with our data to train the deep learning models. That would be very helpful. An alternative to labeling the data also that I've seen is the hospitals will hire or do a survey, have the community come in and get them up to speed with how to identify, detect, and segment these lesions and stroke, MRI and CT scans, and then have community contribute to the effort. And then have a few radiologists just double check those annotations that the community made. That would be very helpful. And these are just some of the data preparation steps to overcome this medical imaging data problem, so we can get a smoother transition to the AI development. I have a few questions for the experts, the radiologists, the healthcare providers out there. Is stroke classification important? So do we want to, from this particular image, recognize that this is ischemic stroke or hemorrhagic stroke? My own answer, I think it is very important, especially because if the patient is dealing with a hemorrhagic stroke, that's more deadly and fatal to the patient, so it would be important. With ischemic stroke, that is also important to know about because in that case, again, there's typically some external factors that could be causing it that the patient could get control over, with, again, the cholesterol, the hypertension, and so those issues can be overcome, as well as with recommended medication. The other question is a particular stroke classification needed. So once we recognize that this is ischemic stroke or hemorrhagic stroke, is a characterization of the stroke important? So we know it's ischemic stroke, let's say, and so is this a embolism, thrombotic, or watershed stroke? The other area to look at with hemorrhagic stroke, is this an aneurysm or arteriovenous malformation? Another area is looking at the data set. So with Kaggle and with a lot of these grand challenges that come out for medical imaging data sets, typically the data is provided in 2D or 2.5D. But typically what I've heard from some radiologists is to deploy deep learning models into clinical applications requires them to be trained on a full 3D data set, MRI or CT and so forth. So how should we go about solving this 3D clinical stroke data problem so we can get access, again, to full 3D clinical stroke data set? And then the final question is, do you see more radiologists and medical resident students getting involved in helping with this data problems, data preparation, potentially the AI algorithm development for medical imaging? Thank you.